Part 44, Mask Use in Infants. Welcome to the lesson on mask use in infants. In this video, we will discuss the steps of mask use in infants. Mask use in infants. Giving breaths in CPR is generally safe. However, use a mask if available. You should use it. The mask fits over the infant's mouth and nose. Many masks have a pointed end, which should go over the infant's nose. Make sure the mask fits properly. If it is too large, a proper seal cannot be obtained and your efforts to deliver breaths will be ineffective. Giving breaths with a mask. Step 1. Place the mask over the infant's mouth and nose. Step 2. Open the airway by performing the head tilt/chin lift maneuver. Step 3. Ensure a good seal between the mask and the face. Step 4. Give a breath for more than 1 second and watch the chest rise. This concludes our lesson on mask use in infants. Next we will review activating EMS for infants.